Smallpox. Smallpox was humanity's worst nightmare for thousands of years. We're talking ancient civilizations completely wiped out. Once you caught it, you had maybe a 30% chance of survival, and that's being generous. The skin would break out in horrific pustules covering the entire body from head to toe. Gruesome. It spread through respiratory droplets so easily. One cough and you're infected. For centuries, it killed around 300 million people. That's more deaths than most wars in history. But in 1796, Edward Jenner created the first vaccine using cowpox. Revolutionary. It actually worked. By the 1980s, smallpox was eradicated completely, the first and only human disease we've successfully eliminated. That shows what science and global cooperation can actually do. Polio. Polio is insidious because it attacks your nervous system silently. It goes after motor neurons in your spinal cord that control muscle movement. You could wake up completely paralyzed. One day you're fine, the next day you can't move. Children were hit hardest. In the 1950s, polio epidemic swept through America, leaving thousands of kids in iron lungs just to breathe. Iron lungs, massive mechanical devices just to keep people alive. The virus spread through contaminated water and food. Before Jonas Salk's vaccine in 1955, parents were terrified to let kids play outside. They kept children indoors. Today, polio is almost gone thanks to vaccination campaigns. It shows how fast a virus destroys a generation if left unchecked. Measles. Measles sounds mild, but it's incredibly contagious. One infected person infects 12 to 18 others. The virus spreads through respiratory droplets, causing high fevers, rashes, and white spots in your mouth. For healthy people, measles sucks, but you survive. For children, elderly, or immunocompromised people, it causes pneumonia, brain inflammation, and death. Measles was nearly eradicated, but vaccine hesitancy brought it back. People stopped vaccinating, thinking the disease wasn't a threat. Wrong. The virus waited. Communities with low vaccination rates saw outbreaks again. Herd immunity is fragile. You have to maintain it. Ebola. Ebola is the scariest virus here because the mortality rate is terrifying, 25 to 90% depending on the strain. The virus causes hemorrhagic fever, meaning you bleed internally and externally. Organs fail, it's brutal. Ebola spreads through direct contact with blood or body fluids, which is why healthcare workers are at massive risk. There's no cure, only supportive care. Your immune system has to fight it while doctors keep you alive. The 2014 West African epidemic killed over 11,000 people. Catastrophic. Ebola can hide in animal populations and jump to humans. Fruit bats are thought to be the natural reservoir. One spillover event and you've got an outbreak. Prevention through hygiene and containment is everything. COVID-19. COVID-19 hit like nothing in modern times. A coronavirus that spread globally in weeks. Millions infected, millions dead. COVID was novel, meaning humans had zero immunity. It could be asymptomatic, so people spread it without knowing they were sick. The virus attacked the respiratory system, causing pneumonia and organ failure in severe cases. Healthcare systems got completely overwhelmed. Hospitals couldn't keep up with the demand. The pandemic forced the world to shut down. Entire economies froze. Schools closed. Borders shut. Within a year, multiple vaccines were developed. mRNA technology proved its worth. We've learned how to live with COVID now. It humbled humanity and showed us how unprepared we were for a global pandemic. HIV. HIV is different because it doesn't kill you quickly. It slowly destroys your immune system over years or decades. Once HIV infects your CD4 cells, which are crucial for fighting infections, your immune system deteriorates. Without treatment, it progresses to AIDS, where your body can't fight any infection. A simple cold could kill you. You become vulnerable to every pathogen. HIV spreads through blood, sexual contact, and mother-to-child transmission. Since the 1980s, HIV has killed over 40 million people. Absolutely staggering. But antiretroviral therapy changed everything. People with HIV can now take medication and live normal lifespans. The virus becomes manageable. Prevention through education and PrEP medication is working. HIV went from a death sentence to a chronic, manageable disease. Progress is real. Yellow fever. Yellow fever is transmitted by mosquitoes, which makes it especially dangerous in tropical regions. The virus causes fever, jaundice, which is why it's called yellow fever, and hemorrhage. Some infected people develop severe disease with organ failure and death. The mortality rate for severe yellow fever reaches 50%. That's terrifying. Yellow fever had major outbreaks throughout history, devastating cities and entire populations. Mosquitoes are the vector, spreading the disease from person to person. A vaccine for yellow fever exists and is effective, but many at-risk populations don't have access. Climate change is expanding mosquito ranges, meaning yellow fever could spread to new areas. It's a reminder that tropical diseases haven't gone away. They're waiting.